Then, hello everybody. Today we're going to hear from Professor Elizabeth A. Bakusi. Dr. Bakusi earned her general medical degree and master's in obstetrics and gynecology degree from the University of Nairobi. She then earned a certificate in international health, MPH, and a PhD from the University of Washington's Department of Epidemiology, a postgraduate diploma in research ethics from the University of Cape Town, and a master's in bioethics from the Center for Bioethics and Culture at the Signed Institute of Urology and Transplantation in Karachi. She is a certified IRB professional. She is a chief research officer at the Kenya Medical Research Institute, also known as KEMRI, a research professor at the University of Washington in the departments of obstetrics and gynecology and global health, an honorary lecturer at Aga Khan University in Nairobi, also in the Department of OBGYN, and volunteer clinical faculty, and professor at UCSF in the department, my department of OBGYN and reproductive sciences. Her primary areas of interest in research focus on sexually transmitted infections, reproductive health, and HIV prevention, care, and treatment. And she has a keen interest in research and clinical ethics, research regulatory systems. And we're looking forward to hearing from her. Welcome, Dr. Bakusi.
Thank you very much, Kimberly. And it's a great privilege for me to be able to talk to the scholars. It's evening my time, maybe morning or maybe a different time of the day for them. And I thought that I would talk about success in global health careers. A number of people have told me, and they have told me that I seem to have been successful in global health. And sometimes they've asked, so what has made it successful? What has made you have a successful career? What has kept you working in global health? What is it that makes you wake up in the morning and look forward to another day? And when I reflected on this, when I was asked to talk to the scholars, I thought, for me, in other words, it reminds me of climbing the mountain. I have had an opportunity to climb a mountain that is reasonably high, Mount Kenya. It's the second highest mountain in Africa. And it boasts the fact that even though it is on the equator, it is snow-peaked during certain times of the year. In fact, most of the year, even though the snow cap has been receding because of changes in the climate. But climbing a mountain for me has been, in many ways, quite a little bit like building a career in global health. And I thought about what are the things that might have contributed to what others may see as a success. And that's what I'd like to share this evening, and then maybe provide some opportunity for us to just discuss together, and maybe I'll be able to answer a few questions. So what is it that makes one be successful? If you do want to do research, if you do want to have a career that will perhaps impact the lives of those around you, or even have a broader impact to those that you will never know or never meet. This is the entrance, one of the entrances. There are actually a number of different ways you can enter Mount Kenya National Park, which is what you need to enter in order to climb Mount Kenya. And this is one of the entrances. It's called the Narrow Moru entrance. This is one of the steeper ways to get up Mount Kenya, but it's one of the faster ways because you can get up relatively quickly. I hope to be able to talk about these points that I've listed here, which really for me, like I said, it reminds me of climbing the mountain. Curiosity and a willingness to learn, collaboration, networking, thinking about having a work-life balance, what it means to be persistent, the fact that there will be open doors and closed windows. Sometimes they actually open windows and close doors. Talk a little bit about the importance of dissemination of information, and end up with thinking through issues of integrity. So let's talk about curiosity and a willingness to learn. This is one of the points. As you climb up Mount Kenya using the Naromoro Road, you get to Met Station, which is your first stop of real rest, and it is much needed rest usually when you get there, because you will be starting to feel the altitude. I think curiosity and a willingness to learn is one of the most important things. The question one needs to ask is, do I eat the turkey or does the turkey eat me? Or perhaps, thinking about it from a different point of view, maybe what I'm holding in my hand might be used to persuade the turkey to leave me alone, or might convince the turkey that it shouldn't come anywhere near me, or might make me feel a little bit better about this big giant thing that may be scaring me and that I may want to find out about, but I may not be very sure. So if you have a sense of curiosity and always thinking about what's the next thing, why, you ask questions when you're in a queue, you ask questions when you're standing in line waiting for something to happen, you ask questions when you're on a bus or when you're taking a ride, then maybe thinking about a career in global health may be a good way for you to go. Because it does require that you're constantly asking, not accepting the status quo, not assuming and not making assumptions that everything that you see is just as it is, that there may be another story behind the story. So what's the place of collaboration in all this? I think about collaboration as working together with others to make something happen. So one of the areas that we've been working in, in the area that we work in around Lake Victoria, in the early years, the roads were very bad. So this is not a make-believe picture. It is a real road. And that was one of our real cars trying to get from point A to point B. We would often skid around in the mud, and occasionally, depending on how skilled the driver was, or sometimes even when the driver was very skilled, we'd still end up in a side ditch. And it required the efforts of not just the team who were traveling, but even the people around you to help get you out of the ditch, hopefully back onto the road in some way, and you would hope that you would get to your destination that day. So to me, that's about collaboration. It's about working with others. People bring different strengths to the table. Maybe you're really good at driving, but not on a muddy road. Maybe even if you're good at driving on a muddy road, sometimes the roads really are impassable. And the villagers who are helping you may have no clue how to drive a car, but it's them who are going to get you out of the mud and back onto the road. Collaboration to me is a very key part of working in global health. Those of us who are in the global south versus those who are in the global north versus those who are in the global anywhere else, there are different strengths we bring to the table. You may have skills, you may have opportunities to ask questions, maybe you don't have the funding. It may require that you work with someone else who may have access to funding, and together you can come up with great ideas, put together a great proposal that will get you both doing the work that you really want to do and answering those important questions that will make a difference to the health of others. So collaboration is about people being equal partners at the table. It's not, oh, I have this and you don't. It's, this is my strength, this is your strength. Together, we make an even stronger team. So true collaboration for me is really at the heart of what successful global health is about. What about networking? And does that differ from collaboration? I think about networking as new opportunities to forge new links, make new friends, work together with other individuals, find new opportunities to do things together. So it's not just about collaboration and whom I'm working with today, it's about who might I be able to work with tomorrow. When I attend a meeting, when I get to talk to others and I hear other things, are there other people that I want to bring into my larger collaboration team? Can I network with other people? Who else can I make connections with? What do they know that I don't know? What can they do that perhaps I am not able to do? And can we together as a team get it done and get it done better? So not just being satisfied with, oh, I'm already working with so-and-so. It's looking for new opportunities to build new bridges, to forge ahead, to make new opportunities to change the world. Global health is demanding. And often, especially if you're working with people who are in different time zones, it means working at different times and at different opportunities. So for example, typically, because a lot of the people I collaborate with are on the Pacific coast, it means I often have to take calls in the evening or do calls in the evening, or they have to do calls in the morning. This calls for thinking about some kind of a work-life balance. There are many things that are important, and careers are very, very important, and we do contribute to hopefully making the world a better place. But what other responsibilities are there? And what other things should we be paying attention to? And I think about the work-life balance as doing the things that only you can do and that nobody else is able to do. And things that you're able to either allow others to do, grow others to do, or give them the opportunity to learn to do them, that you do them. For example, if I have a child who has an important function at school, those are things I can't delegate. I'm the parent. I need to be there. It may be that another colleague of mine needs to take a call to enable me to attend my child's function. My child's soccer game or whatever important event it is, will only happen that once. Nobody else can do that for me. And I need to be able to learn about what are the things that I absolutely must do and what are the things that sincerely someone else can do or can grow to do. Maybe they won't do it as well as I do it the first time, but if I work with them, they can get to be as good or maybe sometimes even better than I would be at that particular task. Often, when you get a letter saying, "Dear so-and-so, we wish to thank you for," you know that the next paragraph is going to be about a regret. Persistence is really important in my mind. The no's are often more than the yeses. But if you don't try, you will never get any no's, but you will also never get any yeses. So you don't quit. Whether it's submitting a paper that needs to be published, whether it's a grant that just missed the pay line, you need to be persistent. You need to try, and then you need to try again, and then you need to try yet again. And just when you think it's too much, you need to try again. Persistence means trying again, not necessarily doing exactly the same thing. It has been said that the madness is doing exactly the same thing over and over again and expecting that you'll have a different result. It is trying again, but it is thinking, what can I do better? What can I do different? What else should I have paid attention to? Often the critique or the comments are really helpful because it does say to you, somebody else who's looking at what you think was crystal clear didn't get it the way you thought they would. And you have the opportunity to rethink it and to redo it again. But persistence is a key part. If you don't try again, like I said, you'll never get any no's, but you will certainly never get any yeses as well. Sometimes, no matter how much you persist, the door's shut. Sometimes it's a window. It's a no. It's not happening. It's not working. It just is not moving ahead. That's when sometimes you need to take a pause and think, what other opportunities are there? I think about as a young researcher, how I was frustrated with research ethics systems where protocols were submitted and took forever and you didn't know why. And sometimes when you got questions or answers back, you wondered, did the person who gave me these comments even read my proposal? Or are they mixing it with somebody else's? There were closed doors to some extent for me because whenever I asked questions, I was told, you don't know anything about ethics. Why are you asking questions? Wait for your letter. Your letter will come when it does. But for me, that was the closed door or closed window that made me say, I need to learn something about ethics. Since I clearly don't know anything and the questions I'm asking aren't getting answered, I need to find out what is this mystery about research ethics or bioethics that clearly I, as a mere researcher, have no idea about, so that maybe I'll learn something that may be of use to me. As a result of those closed doors, I've been able to go through open windows, and I've been able to be part of changing the research regulatory system, not only within my institute, but even within the country. I've been able to contribute to the communication, to the dialogue, to the systems that are now improving and that are now making a difference. So now the new generation of researchers are finding systems that work a lot better, that are more open to discussion, that are not black and white, where if you get a letter, it's like you dare not ask why, where you can even write to the ethics committees and ask, can I come and present to you? Because I don't think just the written word is perhaps clear in what it is that I want to do. So sometimes when those doors close, or if it's the windows that close, look for the other open window or the other open door, and you may be able to find a way through it that may in the long term be even more beneficial than you might have imagined. This was the team when we got right to the peak of Lenana. Lenana is the third highest peak of Mount Kenya. It's the only one that you can climb without actually using rope material and being on belay. It's the non-technical climb. The other two climbs that go up to Nelian and the very highest point, Batian, are technical climbs that require a lot more training. It's not just a long hike. When you do have results, you need to disseminate it. It's a critical part of being a researcher in global health. And it's not about just the publications, whether your paper got into the Lancet or the New England Journal or some very important high-ranking journal. It's about the community as well. Giving feedback so that people do have an idea that what they were participating in is important, that it is contributing, that there is information. And there's never any scientific information that we find that you can't break down in some way at a level that the stakeholders in the community would be able to understand what they contributed to. If it isn't published, if it isn't written out, if there isn't a report, if there isn't some public forum in which information has been given out, nobody will ever know that it has been done. No matter how hard you've worked, no matter how much money went into that particular piece of research, sadly, it will not have achieved anything if that information does not get out. Even if what you set out to determine doesn't happen the way you hoped it would, a negative response is important because it tells other people, you don't need to do it this way, do it in a different way. Even that is valuable information. So you can see, congratulations, you are now at the third highest peak, Lenana. It tells you how many meters, 49,885 meters above sea level. But you know what? Often things don't go as you expected. Sometimes things really, really go belly up. And it can be things that really have what could potentially be a very disastrous outcome. One of the most important lessons that I have learned as a researcher is the place for integrity. And this integrity cuts across not just collection of data, not just reporting the things that we need to report to the IRBs and to the bodies and the powers that be, not even just financial reporting to make sure that any money that's ever given to you as a researcher is used exactly for the purposes for which it was used. But even when things go in an unexpected manner, that we are able to say, there was a problem here. Things didn't go the way they did. Because when all is said and done, your integrity and who you are really counts. Your reputation in research will be a very important part of who you are and how credible your work is. And your reputation will stand before you and will go before you and will often be the one thing that you can hang or peg everything onto. Because when you are a person of integrity and people know it, it does open doors for you. It does give many other opportunities that you'd never have dreamed of. So being able to be a person of integrity in every single aspect of your research life is a very, very important thing. When you find out something didn't happen and it should have, speak it out. When you find out something did happen that shouldn't have happened, speak it out. When you find out there has been some misappropriation, even if it was not you who authorized it and it didn't happen the way that you wanted it to happen, you need to be able to take the appropriate actions, own up to the mistakes, and take the remedial action that's needed to improve the systems and to make things better. So when you get to the peak and you have been successful, would that be the end of it? I would say no. I've given this example of prevention research, but this could apply to anything else. When you get to the end of it and you've been able to do this wonderful work that has been adopted and is making a difference, it is sustainable, and it's impacting the population, you'll always find there's something else. There's another part of it. You'll pick that feedback loop that tells you there's still this aspect that hasn't been taken care of. I doubt our work will ever be done while the earth still exists and rotates on its axis, because there's always something new. There's always something we haven't quite tackled. There's always something else that needs attention, that needs to be attended to. But if you do want to be successful, it does mean you do need to keep your eyes and ears open. And you do need to be willing to be, as I said at the beginning, have curiosity, the willingness to learn and to ask the questions. Is it easy? No, it will never be easy. It's a very difficult task. But in the end, it is worth it. This is a picture of my first and only grandchild so far. He's called Leo. He's just under a year old. And every time I see him, I remember parenthood was a difficult task. And bringing up 4 young men often had with it challenges that made one think, well, I'm just going to pull my hair out. But now when I see my grandson, oh, it was definitely worth it being a parent, because he is definitely a very fun person to be around. So it won't be easy. Working in global health will have its challenges. There'll be some things that are really difficult and feel like they're completely insurmountable. But in the long run, it will be worthwhile. It will change who you are, it will change how you think about the world. But best of all, if you work on something that can help others, it will impact the lives of people who may never meet you and never know you, but you will have made their lives a lot better. Thank you very much. The peak is always worth looking down from, no matter how hard it is. And if there are any questions or points of discussion, I'd be glad to take them.
Thank you very much, Professor Bukusi. This is Lynette Ongeri, and the talk was very, very inspiring. And one of the things I wondered, looking back, what would you say is the one skill you recognize as key to your success in your research career? What skills, for example, do you think was very fundamental for one to have to build a successful career like you have?
Thank you, Lynette. I'm not sure at what point in time you came on, because I had sort of talked about the points that I was raising as the key things that I think have contributed to being successful. Maybe if I just take us back to the very, very first, the outline, and I'd say for me, these are the key things that I think contribute. Among these, if I was to take, it would be hard to just pick one and say, this is the one that really, really matters. I think a combination of them. And if I was to pick maybe 2 of them, that would be the most important, because I think one would be very difficult for me. I think the curiosity and willingness to learn and persistence would probably be what I would pick on. And then I would add to it perhaps integrity, because I think they do encapsulate a lot of what all the others are about. But I think each one of these points brings an important thing to the table that would be key to making a successful career in global health.
Okay, thank you very much. I think I was wondering around research skills as opposed to just the points that you raised. So when it comes to research skills, what do you think a lot of times that one needs to really focus on to be successful? Because there's so much, I mean, I think coming from, a clinical background, then getting into research, you're bombarded, epidemiology, statistics, there's such a myriad of skills that you have to pick up as a researcher. So I wondered, looking back, what do you think has, would say that is really fundamental in a successful research career?
Lynette, I would go back and actually I would say the same thing, in the sense that if you're curious and willing to learn, I think there are no skills that you won't be able to pick up enough of to allow you to move ahead. Nobody, I think, would expect every individual coming into research to be a PhD biostatistician and able to analyze every single complex thing. That's where collaboration work comes in. While the last day I did my last biostat class, I was so happy because I thought to myself, now I understand the basics, but I hope nobody will ever expect me to be the biostatistician churning out the numbers. But I can collaborate with excellent biostatisticians who are able to do things that I would never be able to do because my training, my thinking is not quite in that same way. That's where collaboration, to my mind, comes in. Even to do clinical trials, one doesn't necessarily have to be a doctor and one doesn't necessarily have to have clinical skills, but you have to work with a clinician, someone who has those skills and who is able to understand them. And I do know social scientists who've done very well even in this field because they have the curiosity, they have enough knowledge, and they have the willingness to learn. So they are able to think up, how do we find solutions to some of these challenges? So I would say curiosity and a willingness to learn would be the first step, because if you have that, then you're able to take the steps that would allow you to move on and build a successful career.
Okay, thank you very much.
You're welcome.
Hello.
Hi, hello.
Hello, it's Catherine here talking.
Hello, Catherine.
Thank you, Professor. I was wondering if anybody hears me. My technology is poor today. But thank you. I've been following up what you have been talking, and I would say it was really inspiring. Like, I concur with Lynette. And the fact that being a woman and what you have achieved kind of touched me. And of your points, I would still go back to the work-life balance. Everything that you have said here is very demanding, and climbing the mountain, getting to where you are, is kind of very demanding. And being a woman in African societies, I was wondering if you can give more tips on the work-life balance. Like, how did you manage being a mother, being a wife, and still manage to do this and get where you are today, where we can look at you and admire what you are today?
Thank you, Dr. Catherine. I think that's an important question. And I agree with you that perhaps in an African setup, the question may be even more important and even more relevant because of certain expectations. There are cultural expectations that may require or demand more of women in Africa than they may in other parts of the world, where people may have accepted that there's more gender, not equality, but equity, and where certain roles and responsibilities are not always expected that it is purely the woman who will take responsibility. I say that, for example, that I know friends or colleagues I've worked with in the Western world where their partner or their husband would be much more willing to take on responsibilities, for example, of caring after children. And I've known of colleagues who, despite everything else they need to do, they're the ones who are the primary caregivers of the children as well. But we do have an advantage, even within our African setup, that even though there is a requirement for a lot of childcare and other household responsibilities, because we have what I would consider relatively cheaper labor for childcare, where we're able to have live-in nannies and live-in house helps who are relatively affordable based on our standard of living, it is possible to have a lot of care and a lot of support given from this kind of staff members within the family. So I would say getting help, whether it's from family members who live with you, because again, within our African setup, there are a lot of extended families. Sometimes in the Asian setup, there's also that. People live with a lot of extended family. So that not all responsibilities are entirely on your shoulder. There are other people who are able to give help or give support. So finding individuals who would be able to provide you with good support and then taking good care of them. I had a sister, a younger sister, who was going to college, who lived with me part of the time when I was doing my master's in public health. And she was a big help in being able to drop and pick children when I was away at the University of Washington doing my master's in public health. So finding individuals who are able to help with some of the caregiving activities is very important. But that being said, one of the things I'd said was that there are things you can never and should not, to my mind, delegate. There are certain things that require you as a parent and you being available. So it's finding that balance that says, this is something that only I can do. When my child is performing in a play, even if I send someone to go and watch them, I've missed the opportunity to watch them. And my child knows that I'm not there. So there are some things that even though the child will be happy that somebody came, you who is their mother or you who is their father were not available. And they'll never do that play again, at least not at that age, 6 or 7 or whatever age they are. They may do another play in the future, they may do something else, but that particular moment is lost. I think it's being able to consider what is the relative importance of this and making decisions that one doesn't look back on and regret. And one doesn't look back on and think, I missed that unique opportunity to be part of my child's life and to encourage them, because maybe that was a skill or a gift that they had. And my being there and my being encouraging them and my being part of their life would really have enabled them to excel even further beyond what they could do. So there are some things that we can delegate, and often within the workplace, there are many things that we can delegate, we can grow others to do, we can encourage and work with others. And it's learning that you don't always have to do everything. There are things you can grow others. You have 24 hours in a day. If you work with 2 other people, that gives you an extra X number of hours from each of them more than you have. So growing capacity and building others who are able to work with you is a very key part, in my mind, to managing the work-life balance, but also to being successful in getting others to work alongside you and growing them into successful careers as well.
Thank you so much. That was really helpful. Thank you.
You're welcome.
We have a question on the chat by Michael. He asks, hi, Professor, can you comment on the mentors who inspired you most or influenced you most, and how to maintain mentor transitions, especially as mentors switch or as you transition?
Thank you, Michael. That's an excellent question. I haven't mentioned my mentors in specific, but I think they are a very, very important part of what allows one to be successful. How do you maintain mentors? I think, first of all, you need to define what kind of mentors one is talking about, because people will mentor you for different things. To imagine that you will have only one mentor who will mentor you in every single aspect for everything that you need, I think would be a fallacy. It would not be real. You will have mentors who will support you in different aspects of your life. And I have found that when I'm able to have mentors for different key areas, then it doesn't burden one mentor overly. And it also allows me to develop a relationship with my mentors that can stay for a long period of time. From a career perspective, my mentor I would consider has been Professor King Holmes of the University of Washington. He has worked most of his life in the field of sexually transmitted infections and has done a lot of work and has mentored many people, many of who have gone on to be world leaders themselves. People like Alan Ronald from Canada and Peter Piot, who was the first UNAIDS director, are people who were mentored by King Holmes at some point in time. So how do you retain those relationships? I think finding mentors who not only want to grow you and who are proud of you when you develop, but also mentors who are not in competition with you, who do not feel threatened by the fact that they help you be successful. If they're mentors who are proud of your success and are happy to follow what you do and happy to look for opportunities, always pointing you to what's the next thing that you would be able to do. King would often say to me that his greatest pride was in seeing his mentors succeed. And if his mentees succeed, and if his mentees did even better than he would ever have done, That was a great win for him. I have had other individuals, I wouldn't necessarily call them mentors, but people I have worked with who didn't have that kind of attitude, who had sort of an attitude where they probably felt you were in competition. And if you were successful, it was like they would look for opportunities to either trip you up or to make it like you didn't do as good as you might have. I would say those are the kind of situations where it's best to walk away from if you are able to, or work minimally with people who add negativity to your life or who don't encourage you or help you to be able to achieve your aims. There are transitions in life, and you transition to a point where even someone who was your mentor may remain your mentor, but from a work perspective, perhaps you more become like co-colleagues. But remember, there's even space for what I call peer mentoring. A mentor isn't necessarily always someone who is way, 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 way 100 steps ahead of you. Sometimes a mentor is a peer, and I've had one such peer mentor, Dr. Craig Cohen, with whom we've sort of grown over the period of time, learned to agree and disagree, learned to work together, learned to maximize our strengths, and learned to support each other in improving the areas in which we would discover we had weaknesses. Because every person has a mixture, a balance of things they're good at and things they're not so good at. None of us will ever be perfect. So even when you work with others and when the transition changes or there are transitions in life, it's recognizing relationships won't always stay the same. Sometimes people move on and move to other places. I've had people whom I've mentored who are now growing into very successful careers of their own. And the question I always ask is, how do I support them? Sometimes it means that I need to let them break away. I need to let them set up something that works for them outside the unit that I'm working in, because maybe there isn't enough space for all of us to work together in that particular unit or in that particular way. So when those transitions happen, it's finding ways of being able to communicate in an agreeable manner and finding ways to give each other the space, because in the long run, we're trying to achieve the same thing, even if we're doing it in different ways.
Thank you.
Welcome, Michael.
We have another question from Melissa. She says, I am curious, what are some things you can do as a global health researcher in an academic institution that you could not do as a global health researcher or official in a government institution?
That's an interesting question, Melissa, because the research institution I work in is a government institution. So in a sense, I am part of a government institution, but the mandate of the institution that I work for is research. But if you ask what are the things that you can't do in a government institution, I would say the challenges with government institutions is not so much that you can't do it, but that they tend to be bureaucratic. And often the ease with which one can work in a smaller non-governmental organization, or perhaps sometimes in some not research institutions that are not governmental, or that universities that may be perhaps not public or non-governmental universities, is that they have a lot less bureaucracy. Government tends to have procedures and require things to be done in a certain way. For example, procurement can be very onerous in a government institution, where there must be certain thresholds, certain ways done. And it's not so much that the non-governmental doesn't do those kind of thresholds, but they just do it faster and do it simpler. Government may just have layers and layers, and it takes an amount of time. And then it's not only your procurement, maybe it's a procurement of everybody else. And if it's a big institution, there are many people whose procurements must be considered. And so it's just that question of time and effort and the bureaucracy that may delay processes within government institutions. But I can't think of anything that I would say that I have not been able to do as being part of a government institution. And I can think of advantages, because often when you are within a government institution, it does open certain doors and certain windows that it is easier for me within a government institution to reach, for example, the Ministry of Health, the National Ministry of Health, because I am part of the research arm of the government for health, that I can say, there's this that we want to do, or there's this that we're interested in, and that I will get the ear of individuals who are high up in government, because I am part of an institution that the government has mandated for health research. So there can be benefits to working within a government system. But processes tend to be slower, take longer, and require more follow-up in general.
Thank you very much.
Thank you so much, Dr. Bukuzi. I actually had some questions from Dr. Klausner as well, and I wanted to share them with you. So thank you so much for talking about collaborations that we should be making. But one question we had was, how do non-US scientists create and maintain successful collaborations with US scientists?
That's an excellent question. And I think it not only relies on non-US to US, but it relies on collaborations with others. How do we form collaborations with people in Europe, collaborations with people in Asia, collaborations with people in Australia, and everywhere else? I think basically it's a question of what is a collaboration. A collaboration is about how do two of us or three of us or a group of us who need to get something done together. We need to get that car out of the mud. We need to get it back on the road. We need to get it moving. We're working together. And the question becomes, what do you bring to the table? What's the strength? Is it recognized? Is it appreciated? I'd said earlier that some of these people who are pushing this car may not know how to drive a car. They can't get into the car. They can't start the car. They don't know how to move the gears. They don't know how to step on the brake pedal or onto the accelerator. But if you don't have them alongside helping you when you're stuck in that ditch, you'll never move that car. You'll never get to your destination. I have found over the years that when collaborations have broken up, often it's been because there hasn't been a respectful conversation and people have not appreciated what other partners are bringing to the table. Because someone may have access to funding, or because their country may put a lot of funding on the table, and as a citizen of that country, they have the access to be able to apply, that doesn't make them the senior partner. That doesn't make them the person who must make all the decisions. When everybody is respectfully considered at a table, I find collaborations work and work for a long time. So it's looking at what does each partner bring to the table and how do we maximize that for the greater good of everybody else.
Thank you. Another question we had was, what are some of the most effective ways for non-US scientists to maintain a research program outside the US?
I think the most effective way to maintain any research program, be it in the US, be it outside the US, it comes down for me to a question of systems. And this to me makes me think a little bit about what I said with regards to issues of integrity. Integrity really comes about from having systems that work, because integrity doesn't mean that everything is going right. It just means even when things go wrong, you can pick it up and you can loop it back and figure out how to make it work back better. Yes, the accident happened. The car rolled. It went off. The question is why? Was the driver driving too fast? Did an animal suddenly appear on the road? Was it raining? Was it slippery? Was the car faulty to start off with? So it comes back to the question of systems, having systems that function. Systems that function, that are able to pick up when something goes wrong and allow the system to be rectified and made better. To me, this is important for working outside the US as well as working in the US. Having systems that work, that allow information to flow. Because for a lot of research, it's not just about your excellent ideas. You may have excellent ideas, write beautiful grants, get them funded. If you don't have a system for how you actually implement it, your beautiful ideas will stay beautiful ideas on paper that will never get to a point where they can make an impact or help anybody be able to improve the lives of people around them.
Thank you. That's really helpful. I would ask anyone else who has questions to please either put them on the chat or unmute yourself and ask those questions. If not, we have actually some more questions as well, Dr. Pukuzi. How do non-scientists, how non-US scientists obtain positions at US institutions?
Good question. How do non-US scientists obtain positions? I think this comes about from having collaboration over a period of time. And once you've been working with a US institution, people may see what value added you bring to the table. And perhaps in wanting to forge longer term relationships, wanting to have an opportunity where you can continue to work over a period of time, there may be openings for you to either serve maybe on advisory boards, or even to have a position that then allows you to be able to engage formally with that institution, recognized as a person contributing to that position. Let me just say that when you have a position or have that kind of relationships, not all of it is monetary. In fact, a lot of it, you're honorary or you're volunteer. And so what you get out of it is that you have the position that then enhances your CV. You have the opportunity to formally contribute to that institution. But it does not necessarily always mean that there's a monetary value in terms of you're paid in actual cash. It may, however, provide you with the opportunity, depending on what kind of position you hold, to be able to either apply for or look for grants with that particular institution, because certain conditions may apply. Sometimes the grants require not just that you have a position at the university, but it may look at issues of your citizenship or where it is that you're affiliated or where it is that you work and live. But it does give you the opportunity to raise your profile and does give you opportunity for seeking certain grants or small grants within the particular university that may allow you to be able to start up your studies. Let me give a specific example. For example, the Center for AIDS Research Grants, the CIFA grants that many US institutions working in the international arena have. If you have an affiliation with the US universities, often you are eligible to apply for the CIFA grants. While the CIFA grants themselves are not very large, they are excellent seed funding to be able to start research that would give you preliminary data that would now allow you to be able to apply for a bigger NIH or CDC or USAID grant, given that you already would have had some kind of information that allows you to build on your research.
Thank you so much, Dr. Pukuzi. I think it's so important to know that these relations are more than just monetary, and that there's other benefits to being affiliated with US institutions. Another question, kind of following from our previous discussion, is what are the primary funding entities that support global health research outside the US?
Outside the US, I would say the ones that come to mind immediately, the EDCTP, the European and Developing Countries Clinical Trials Platform, has been an excellent opportunity. It brings European Union funding together. And this was started before the UK was moving out of the European Union. And the UK still has a role, and I think they're still contributing, and there are mechanisms which I think it will still stay part of EDCTP. For anybody working in sub-Saharan Africa, EDCTP is an excellent opportunity to look for grant funding. They are very specific in the areas that they're trying to build research on, but now they've opened it a little wider, going all the way from not just malaria and HIV, but looking at other neglected tropical diseases, looking at issues of maternal and newborn health. And they go all the way from phase 1, all the way to post-marketing pharmacovigilance studies. They provide funding not just for research, but even for training and capacity building. And even on the regulatory front, they are interested in providing funding that improves regulatory systems within countries. So EDCTP is one good mechanism. The UK MRC has also been another source of funding. They've been very specific in the kind of funding that they've been offering. But beyond offering funding at the MRC level where you apply directly, they have also been partnering with other organizations. For example, the African Academy of Sciences, AAS, where they have specific grants that they're making available for developing research in different areas. And they fund not just health research, but a whole variety, including research in maths and engineering and climate. So they have a very broad arena of research that they provide research for. So the African Academy of Sciences, AAS, would be another place to look at because they've been partnering with, for example, the Newton Fund in the US and in the USA, in the UK, and other funding agencies who are willing to channel money into the AAS to be able to make it available for scientists in largely sub-Saharan Africa. So those are the ones that would jump out at me. For people who are perhaps in Asia, there are other funding mechanisms which I'm not as familiar with, since I guess I don't look for them. But I know that the Australian government does put some significant funding into the Pacific area and into the Asian area, where there are grants that are available for people in those areas as well.
Thank you, Dr. Pukuzi. I think most of the fellows are in sub-Saharan Africa right now. So I think this is really helpful. A follow-up to that question would be, what do you think are the research priorities of these research institutions, funding institutions?
The funding institutions will really differ because I wouldn't say that all their research priorities are the same. For example, a lot of funding has been coming from the Bill and Melinda Gates Foundation, for example, and there are many foundations like them who have been giving funding. Sometimes they're very specific on which countries they want to fund, even within the developing world. Sometimes they, partner with other government agencies like the NIH and CDC and USAID and the MRC and so on. So sometimes they're willing to co-fund with others. Sometimes they fund directly. And their own funding may also be linked to what are their key areas of interest. For a long time, the Bill and Melinda Gates Foundation funded a lot of research around HIV. They've expanded. I've seen a lot more research in even the agricultural area where they've been funding things and around climate. And I've also seen them moving towards funding even some issues around non-communicable diseases and cancers. So the funding priorities will differ at any point in time. I don't think I've seen where I would say, these people are only interested in funding this particular thing and nothing else. Unless it's a foundation that was specifically set up to fund one specific type of research, and then they may stay true to that particular funding. But in general, I've seen that there seems to be a variety that is sort of determined by what's going on in the global health arena. For example, the EDCTP was funding a lot of malaria and HIV, but when the Ebola outbreak happened, 2013, 2014, they diverted funding because that was an important emergency, that was a global health issue that needed to be dealt with. And so funding was diverted and calls were made to deal with emergency responses to outbreaks like Ebola. And they did fund some work on early Ebola vaccines and work around epidemiology around Ebola. And I'm sure other funding agencies did the same, for example, when there was a Zika virus outbreak. So it does tend to match what is going on in the global health arena and what it is that people are interested in ensuring that we are addressing.
Thank you, Dr. Pukuzi. At this point, I do invite others to ask any questions. If not, Dr. Pukuzi, thank you so much. This was a very inspiring presentation. And I see Kimberly, would you like to say something?
Oh, I was just going to agree with that. Yes, thank you. That was a really great presentation and great questions from everybody. So thanks to Dr. Pukuzi and to all the participants.
Thank you very much. Thank you for listening. And I wish you all success. I look forward to you giving similar talks in the future.
Thank you.
Thank you.
All right. Have yourselves a great day or a great evening, depending on where you're at.
Thank you, Dr. Bukusi.
All right, bye.
Bye.
Bye-bye.